The temporal fossa has a couple of boundaries. First of all, we have the anterior boundary, which is where the zygomatic process of the frontal bone is located. So this is going to be your frontal bone right here. And the frontal process of the zygomatic bone. This is your zygomatic bone. Then there is the superior and posterior boundaries by the superior temporal line, which should be around this area right here. Then there's the inferior boundary marked by the zygomatic arch, and the floor, which is composed of the portions of the parietal, frontal, greater wing of the sphenoid, and squamous part of the temporal area where four bones approach each other. And this area is actually known as the pterion, and that is this area right here. This area overlies the anterior branch of the middle meningeal artery, and a laceration of that artery is the most common cause for epidural hematomas. In the temporal fossa, we have a couple of contents, including the temporalis muscle and its fascia, the deep temporal nerves and vessels, the superficial temporal vessels, the auriculotemporal nerve, and the zygomaticotemporal nerve and vessels. In the infratemporal fossa, we got a couple of boundaries. Anteriorly, it's going to be the body of the maxilla. Medially, it's the lateral pterygoid plate. Laterally, it's the ramus of the mandible. Superiorly, it's the greater wing of the sphenoid bone. And this is open to the neck posteriorly and inferiorly. The communications is with the temporal fossa via the space between the zygomatic arch and the cranial wall. Also with the orbit via the inferior orbital fissure. Also with the middle cranial fossa via the foramen ovale and the foramen spinosum. And with the pterygopalatine fossa via the pterygomaxillary fissure. The contents of the infratemporal fossa include the lower part of the temporalis muscle, the medial and lateral pterygoid muscles, actually the one you're looking at right now, it's the medial pterygoid, the mandibular nerve and its branches, the chorda tympani, the otic ganglion, maxillary artery and its branches, and the pterygoid venous plexus and maxillary vein. The temporomandibular joint, also known as TMJ, it's a synovial joint established between the mandibular fossa and the articular tubercle of the temporal bone and the head of the condylar process of the mandible, also known as the mandibular condyle. The articular disc is another part, very important. This is an oval plate of fibrous tissue which is located between the temporal and mandibular articular surfaces, which separates the joint into the superior and inferior compartments peripherally, and it attaches to the joint capsule and it moves forward and backward with the mandibular condyle. There's also an articular capsule which surrounds the joint like a sleeve, and it attaches above the articular tubercle and the margins of the mandibular fossa, which attaches below to the neck of the mandible. Now the TMJ also has a couple of ligaments. We're going to start with the lateral temporomandibular ligament, and so that's going to be this one right here. This ligament strengthens the lateral aspect of the joint capsule, passes inferiorly and posteriorly from the articular tubercle of the neck of the mandible, and it limits the posterior and inferior displacement of the mandibular condyle. In here we also have another ligament called the sphenomandibular ligament. In order to observe it, we have to tilt this head, and you're going to see it right here. That's your sphenomandibular ligament. And this one lies medial and deep to the mandibular ramus. It extends from the spine of the sphenoid to the lingula and the posterior margin of the mandibular foramen. That's where you would see it better, this angle, this inferior view. And lastly, we also have the stylomandibular ligament, which is this one right here. This ligament lies posterior inferior to this area, and it separates this area from the joint capsule. It extends from the styloid process to the posterior border of the ramus of the mandible, just superior to the angle of the mandible. The nerve supply to the TMJ is derived from the branches of the mandibular nerve V3, the auriculotemporal nerve, which is the main source of the nerve supply. The mesenteric nerve supplies the anterior part of the joint. Also, the blood supply to the TMJ these are branches of the superficial temporal and maxillary arteries. And the movements of the TMJ include elevation, depression, protrusion, and retrusion, as well as right and left lateral excursions.